the anterior chest. So now we can move on to the posterior chest. So the posterior chest, we're going to again
From the
be
anterior
inspecting.
chest,
We're
you
going to
can move on
inspect
to the
for
posterior chest. And again, this would be done with the gown off.
color
We're going to be
lesions.
inspecting
We're
the
looking for
patient
muscular
for
development back here as
symmetry,
well.
color,
Spinal
lesions. We're
alignment
looking
and
back here for
posture.
muscular
So
development
looking to
as
make sure
well.
the spine is
And you
straight.
can check for
Sometimes we
spinal
can have them
alignment.
bend
If you
forward
want to
just
have
a
your
little
patient
bit
sort of lean forward, you can see the
and
spine a
assist
lot
the spine a little
easier.
bit better. So spinal alignment is
And
good.
then we're looking at overall posture.
I
Is the
know
patient
differential
sitting
development, so good
evenly,
posture.
symmetrically? Are they posturing in
After
any sort of
inspection,
way
we're
or
going
leaning to a
to
side?
palpate. We're going to palpate for temperature, moisture,
After
texture,
inspection, we
joint
palpate for
morphology,
temperature, moisture, texture, tenderness, and then any deformities that we note
here.
in the posterior chest.
And then you can palpate the spine as well right here, just to
Then we're
make sure.
palpating the vertebrae
And
for
it's easier to
alignment
palpate than
and
just feel.
scapula for
So
placement.
spinal alignment is really good. Um,
And then finally, we'll
okay, you're going to grab
auscultate
your
in the
stethoscope this
posterior
time.
chest as
You're
well, just
listening
like
to
the
what sounds like you're going to
anterior
the side.
chest. You're going to be using the diaphragm of the stethoscope. We're going to start at the apex and then move side to side to listen for symmetry. A posterior chest, I usually listen on more spots than the anterior just because it's a lot easier to hear from the posterior chest, especially in the bases. So if you're having a hard time hearing in the bases on the front because of adipose tissue or whatever else would be in your way, the posterior chest is a really good way to assess those lung sounds.
So I'm going to do at a minimum 8 back here. Now the bases are really important to listen to because this is where you're going to have fluid accumulation for most of your heart failure patients. You really want to listen closely.